What is the single biggest mistake that I have seen dentists make over the years? Now, it's interesting because I have been doing this for 30 years now, and there's one thing that I see over and over that costs dental practices the most money. That's what I'm going to be discussing in this week's tip. All right, here's the biggest mistake you guys make that I see when running an established practice. Now, if you have a scratch practice, this does not necessarily apply to you yet, but it will one day, because one day you will have an established practice, so pay attention. Now, to understand this mistake, the first thing that you have to understand is that your production is driven by your treatment acceptance. Now, what do I mean when I say that? What I mean is you cannot produce dentistry if you do not get patients to accept the treatment. So if you want to produce $100,000 a month, you have to figure out how to get $100,000 worth of treatment accepted. In other words, in layman's terms, you have to sell $100,000 worth of treatment every single month if you want to produce $100,000 a month. Right? Now, where do these sales come from? In most of the practices that I take a look at, a lot of the effort in the treatment acceptance goes into new patients. So we set aside extra time in the schedule for our new patients. We make sure you have enough time to present the case. We put a lot of money into marketing because we all know there's treatment associated with new patients ordinarily, and that's going to add to the production. So most of the practices that I talk to, the new practices, are very interested in getting new patients. What most people are neglecting or completely forgetting about is that they have existing patients, and that 60% of your charts have outstanding work in them, meaning that the bulk of your production is sitting in your existing patients, not your new patients, and that the bulk of your sales should be coming from existing patients, and your new patients should be your gravy. Now, how do you do this? Well, the way to do this is, first of all, to make sure that you have a thriving hygiene. Now, what do I mean with that? That doesn't just mean that your hygiene is full. It means that the patients that you have under your care, your existing patient base, can be seen in the hygiene slots that you have available. So if you have 1,500 active patients with 5 days of hygiene, there's no way your patients could fit on your hygiene schedule. You simply do not have enough hygiene slots. And what happens when you do not have enough hygiene slots, the patients that are very compliant and easy to handle end up on your hygiene schedule. The problem with that is that because they are compliant and easy to handle, they have already done the bulk of their treatment. And therefore, there's very little to sell in hygiene, and you become new patient dependent. That is a problem because they take more time, they are unpredictable, they have acquisition costs associated with them. I'm not saying you don't need new patients, you definitely need new patients. But for your sales, you need your existing patients to be active. So the first thing that I would do is I would make sure, if you find that you are not getting at least 50% of your sales every month, and I like it to be at least 80, but if you're not getting at least 50% of your sales out of hygiene, I want you to do the following. The first thing I want you to do is I want you to take a look at how many hygiene slots you have available versus how many active patients you have. And that will show you right there whether you have a problem or not. The next thing that I want you to do is I need you to print an incomplete treatment list so that you can see how much outstanding treatment you actually have in your existing charts, and then get your front desk to start calling these people back in for hygiene by expanding your hygiene days or opening extra slots, or if you can't find a hygienist, accelerating your hygiene or doing something that works for you to be able to get those patients in. And then the next thing you need to do is you need to make sure that your schedule is set up, that you have enough time to represent those cases to your existing patients. So that is the easiest way to get the numbers up in a dental practice, to get your production to go up, is to start concentrating on existing patient sales while continuing to do a good job with your new patients. That is my tip of the week. I hope it helps, and if you want to see more tips like this, hit the subscribe button. Thank you.